All right, today we're diving into a pretty fascinating and rare skeletal condition that can be a real diagnostic puzzle for doctors: fibrous dysplasia. Let's jump right in. So, think about this for a second. What if the very framework of your body, your bones, started doing something totally unexpected? What happens when that strong, reliable material you depend on every single day starts getting replaced by something weaker, something different? Well, that's the fundamental question at the heart of fibrous dysplasia. So, what is this stuff exactly? Well, fibrous dysplasia is a condition where the body, for some reason, messes up and replaces normal, healthy bone with this weaker, disorganized fibrous tissue. To make that crystal clear, picture your bone as a solid brick wall, super strong, right? Now, imagine somebody came along and started knocking out random bricks and just patching up the holes with a loose mix of sand and gravel. That wall is suddenly a lot weaker, a lot less stable, and that's pretty much exactly what's happening inside the bone. Okay, so to really get a handle on this condition, you've got to know that it basically shows up in two different ways. It all depends on whether it's affecting just one bone or a whole bunch of them. On one side, you have the monoostotic form. Mono means one, right? So this type affects a single bone. It's actually the more common of the two, and it usually pops up in early adulthood, say between 20 and 30. You'll often see it in the femur, the tibia, or the ribs. Then you've got the other side of the coin, the polyostotic form. Poly means many. This type hits multiple bones, and it tends to show up way earlier, usually before a kid is even 10 years old. It can get worse as they grow, and it loves to affect the skull, facial bones, and the long bones in the legs. Now, here's where things get even more complex. When you see that multi-bone or polyostotic form, that's often a huge clue that something bigger is going on. It can actually be just one piece of a much larger syndrome. So this polyostotic form is linked with two main syndromes. First, there's McCune-Albright syndrome. This is a classic trio of symptoms. You get the bone condition plus endocrine problems like puberty starting way too early and these very distinct café au lait or coffee with milk skin spots. The second one is Mazabrot syndrome, which pairs the bone issues with benign soft tissue tumors called myxomas. So the big takeaway here, finding fibrous dysplasia in more than one bone is a signal to start looking for other things. So, how do doctors actually spot this? Well, this is where the real detective work kicks in, and the number one tool in their toolbox is the X-ray. Radiologists are basically hunting for specific visual clues, little fingerprints that scream, "Hey, this is fibrous dysplasia." One of the most classic signs, especially in long bones like the femur, is something called a ground glass appearance. It's exactly what it sounds like. The affected part of the bone on the X-ray loses its sharp, clear structure. Instead, it looks all hazy and blurry, kind of like you're trying to look through a piece of frosted glass. That haziness, that's the visual signature of all that disorganized fibrous tissue we were talking about. Another really important clue is the rind sign, which you often see in the neck of the femur. What you're looking at is a spot where the bone has been eaten away. Doctors call this a lytic area, but it's surrounded by this thick, hard, sclerotic border. It creates this very distinct shell or rind around the weak spot. And then you have maybe the most dramatic sign of all, the shepherd's crook deformity. Because that fibrous tissue is so much weaker than normal bone, the top of the femur can actually start to bend under the body's weight over time. This slow bowing creates a very unique shape that looks almost exactly like the curved staff a shepherd carries. It's a dead giveaway that you're looking at long-standing, pretty severe disease. Now get this, when the condition hits the bones of the face and skull, the results can be just wild. The source material uses the phrase leonine appearance. Leonine as in lion. The overgrowth of the facial bones can actually give someone lion-like features. It's an unforgettable clinical sign called leontiasis osseosa. Just incredible. Okay, so after finding all these clues and putting the puzzle together, the really critical question becomes, what can you do about it? So for this last part, let's look at how the condition is actually managed. Now, we have to be really upfront here, and this is a direct quote from the research. There is no established effective treatment. That's the tough reality. There's no magic bullet, no cure that can reverse the process. But, and this is a huge but, that does not mean nothing can be done. The focus just shifts from curing the disease to managing its effects on the person's life. So the game plan really boils down to two key things, and it's all about quality of life. First, you've got to manage the pain, which can be pretty significant. This is often done with IV drugs called bisphosphonates that can help. Second, you have to address the structural problems. For really severe issues like fractures or major deformities, surgery is the answer. This could mean scraping out the abnormal tissue, packing the area with bone grafts, and putting in plates or rods to make the bone stable again.